Okay, I'm officially recording. Okay.
Hello, Professor.
Hi, Joy. How are you?
Okay, now that I got in,
Okay. What campus are you from, Joy? Essington. I knew that. And then J Jakesia? Did I miss you? Where are you?
I'm right here.
There you are. Hi. Hey.
Hi,
What campus are you from?
Port St. Lucie.
Port St. Lucie. Okay. All right. Great. I'm missing two students, but we're gonna get going since we have lots to cover today. So, hi, everybody. Um, Tuesday, this is our Tuesday community section. I'm Professor Marvel. I am the course lead for PN Community. So, I have three sections this term. I teach on Monday, Tuesday, and Friday. So for starters, I always like to ask what like horror stories have you heard about this class? It's terrible, it's
And it's
hard,
hard.
it's
Yeah, I heard it's
hard.
hard. A lot of
Mhm.
work.
A lot of work and it's hard.
Oh, okay. What else? Nothing? Oh, that's easy.
Not really caring too much about what we've heard already because we know that you'll make it so easy for us and make it make sense. And so I'm not really worried, right?
Yeah, no need to be worried. And this is actually a fun class, I think. It gets you away from the thinking, most of you, I'm assuming, have med surg and peds, right? And probably some other classes. So this is a busy term. Okay, there's a reason this class is put at the end of your program. Okay, why do you think that is?
Maybe because we're thinking different in this class, thinking out the box
That's part
a
of
little
it.
bit.
So the reason why this class is at the end of your program is it's time to pull everything together, right? I had a student when I had my exit meeting last week with my students. I said, describe this class to me now that you're over it and you've passed it. She said, this is like a med surge course in the community. And I thought that was a really interesting way to put it because it's a very heavy med surge focused course. Because think about it, you're you have you're taking peds, you're pulling all your tools together here because any client in the community can be of any age group. You could be taking care of babies all the way up to the elderly, right? So you have to pull in your ped skills, your fundamental skills, your Jerry skills, your um, pharmacology, med surge. It's time to pull everything together, right? Because you're simply caring for clients in a different setting, right? You're caring for that in the community. We consider that could be a school. I just retired from school nursing, which I'll tell you a little bit about, but that could be a school, that could be a workplace, that could be an urgent care clinic, a medical office building, a long-term care facility, a rehab facility, right? You still need all your skills to care for these people, right? Think about all the people that live in your community that need healthcare services. How do those get done? By community nurses. So public health is the umbrella, and then community nursing falls under public health. Okay, so lots of different areas in the community. This class is an overview of what community nursing, what the roles are and the tasks are. Um, so yeah, so that's why it is at the end of your term, because most of you probably only have one more term, right? After this, yeah, yeah. You got to pass this class to get through. Okay, you don't want to be repeating this class. This is not a class you need to repeat. Okay, this is 2 credits, and the hours and assignments for those credits line up with 2 credits. It's not a hard class. It's just asking you to look at things differently, providing healthcare in the community setting, whatever that setting may be. Okay? So instead of going into the hospital to do your med-surg clinicals, you're going into the home and providing whatever care is needed. Does that make sense? You just have to think differently.
So basically, you're just providing nursing care that will fit to the community that you're
Yeah.
in.
Whatever setting you're working in the community. So for example, I was school nursing, 22 years in school nursing. So my setting was the schools, right? Where an occupational health nurse, her setting would be in the workplace because that's what occupational health is about. Think of all the different roles that are needed in the community. Home health, hospice, how about hospice care? Palliative care, school nursing, occupational health nursing, faith community nursing. Lots of different, think of the needs of the people in the community. Think of the needs of the people in the hospital. Then they go home. Let's say they've had a stroke or they have a chronic disease, or you have young mothers that need support at home. You have elderly that need support at home. Whatever that support might be. Community health is all about collaboration. Okay, you're usually working with a team to take care of, let's say it's the elderly, maybe you're working with PT and OT, home health. So I simply ask you to just look at this differently. You don't have any clinicals, you don't have any sims, you don't have any labs with this class. Take off your hospital hat and open your mind to providing care in the community. And if you've never worked in the community, sometimes you really don't think about all that needs to get done for clients in the community, right? They have health needs too. And it's not only people being discharged from the hospital that need care, but you have people living out in the community that don't need hospital care, but they need home support care, or they need rehab, or they need to go to the urgent care, or they need to go to the doctor's office. Okay. So the community setting is anything outside the hospital, right? Chikisi, does that make sense? Yeah. So that's what I need you to open your mind to is we are providing, as my student said last week, med-surg care, or you could say peds care or OB care or fundamentals in the community setting. Okay. So this class is an overview of what that looks like. It's not hard. There's not a lot of work. There really isn't. And we'll go through that when we get to the modules. So I'm going to cover that. I'm sure maybe some of you haven't, but I have to cover that orientation PowerPoint. I don't know if some of you have already been in a class yesterday that covered it, but I need to cover it. Is there anybody that hasn't seen it yet? Okay, so I have a few, so I need to go through it. Does anybody have any? So we'll go through the PowerPoint and then we will go back and look at the syllabus, and then we'll look at the modules. I want to point out some assignments to you. So my background is this past May, I hit my 40-year nursing mark. I know I'm aging myself here, but I started out in the Navy. I was a Navy nurse, which I loved. And then I moved to Denver and did about 18 years as the director of women's and children's services at a big hospital in Denver. When I started, we were doing 60 births a month. When I built their whole program, we had like 600 when I left. What made me want to do Navy nursing? I grew up in Boston, and when I graduated from college, believe it or not, there was a surplus of nurses. Surplus. So there wasn't a lot of jobs for new grads. So I took a job at Boston City Hospital. and on a night shift on a like a rehabilitation unit for substance abuse addicted people. And about 2 months into my new grad job, one of our patients got out of his leather restraints and really kind of beat me up, basically. Got really, really injured from that. My parents said, "Oh, please, 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 we have to get out of Boston City Hospital." But I had my jaw broken. I saw everything. It was a nightmare, and I had just graduated school. So anyway, one of my mom's friends was a retired Air Force nurse. And so I went and talked with her about the military, and she said, give it a shot. And the Navy was hiring. They were desperate for nurses. So I enlisted in the Navy and stayed there for 10 years. I loved it. I was stationed out in San Diego. Loved it. It was the best 10 years. Best 10 years. So I moved to Denver, did director of women's and children's services. So that's where I got all my OB, peds, neonatal, NICU, PICU. So I was the director of that big program. And then I went into school nursing. I was in Denver. I was at Rose Medical Center. Then I went into, my next door neighbor was a principal, and he said, "Oh, you got to get into school nursing with all your 4 little kids. You get the summers off, you get holiday, you work the school schedule." So I went into school nursing, ended up loving that. Big district in Colorado, 90,000 kids, 200 schools. So we used to cover, so we weren't site-based. We used to cover anywhere from 9 to 12 schools. So I had kids all the way from preschool all the way up to high school. So I love that. Just retired about 2 years ago from that. And I always wanted to, the rest of my career, I wanted to do education. So that was always in the cards for me. I had the opportunity to come on staff at Fortis. After this term will be a full 3 years at Fortis. So I love it. I love it. I'm exactly where I need to be right now. This is give back time for me. So I'm trying to give back to the new generation of nurses, my career, knowledge, experience, advice, motivation. So I'm in my give back period of my career. So I'm loving what I'm doing. Love it. So this will be 3 years. I have been teaching in both the RN and PN program up until last term. And now this last term and this term, I'm only in the PN program, which is good. I can focus more time on getting things updated and the curriculum updated. So last 2 terms have been very successful for the whole PN program and community, really successful. So I'm confident that you guys will all pass this class. This is a team effort. I have a job, you have a job. Together, we'll all get over the finish line together. There is no need to repeat this class. 0. Okay? So, burning questions for me. I'm happy to have you guys here. I love what I'm doing. I hope my enthusiasm is apparent. The one thing that really I asked for is communication. Okay, if there's anything going on that is preventing you from being successful in this class, you got to let me know. I don't need to know everybody's personal business. I really don't. But the one thing that I am just a stickler for, and I'm not a stickler for many things, is communication. Okay, you got to let me know if there's something going on. This is a class you just don't want to fall behind in. Joy said her computer is acting up. She's going to log off. Okay, thanks for the update. This is a class you just can't blow it off, right? There's not that much to do in this class. If you just carve out a little bit of time each week to get your community stuff done, your work done, I don't mean stuff, but work done, you'll be fine. Then you go focus on your other classes. All right, but there's only 3 exams, 3 exams and 5 quizzes, and then your HESI, right? So, if you fall behind after exam 1, it's just makeup. You're just trying to make it up the rest of the term. So just stay on top of it, okay? And we'll get through the
Can-
workload of the class, but it's just not a hard class. I think it's a fun class. In fact, I always poll my students. I polled them last week. I go, all right, remember you guys were saying in week 1? Now what are you saying in week 12? It's totally different. They're like, wow, we had no idea that all this goes on in the community. Learned a lot. And remember, we're in the next gen mode. We're in that transition mode, which means your exams, your HESIs, as you've seen in your other classes, right? You have knowledge. Now we're applying it to practice, right? That's your next gen mode. So you're not going to get definition questions on the exams or things like that. You're going to get case studies and actual scenarios. We have to put the knowledge. I'll address the assignments being turned in early. Yep. You have to take your knowledge now and put it into practice. All right. This is what I've read is that research, one of the reasons why we're moving to the next gen, clinical, critical knowledge and clinical judgment is because it was determined that a lot of nurses coming out of nursing programs had the knowledge, but they couldn't put that knowledge into practice. And it's fine to have the knowledge, but what happens when you can't put that into practice? That's a problem. Mistakes were happening, mid errors were happening. So now we're focused on taking your knowledge and applying your critical judgment. Okay? Any burning questions? We'll talk about working ahead. I don't really care if you work ahead, as long as you're up to date on all your other classes. And but I'll tell you why I have a little. All right, let me share my screen and let's pull up this PowerPoint. So that's my introduction. Oh, and the other thing too is I'm real flexible, really flexible. Okay, I'm easy to get along with, easy peasy. I'm flexible as far as I can be flexible when I can be flexible. All right, there's certain protocols within the university that I can't be flexible with. All right, but I'm super easy to communicate with, super easy to get along with, super easy to meet with. My Zoom is always open to you guys. 7 days a week. Want to meet in the weekends, we can meet. If you want to meet evenings after work, we can meet. I love meeting with students. So we'll talk about that in a little bit. Okay, so let's just go through this. So this is your orientation PowerPoint for October. It's really not any different than July. All I did was change the month. You guys at this point know what online learning is, correct? Okay, it's just think of it as an on-ground class. You go to class, you sit in a classroom, you participate, you're in a setting that has least amount of distractions. Okay, I think you should be like you're in a classroom, sitting at a desk, with a quiet environment, having a good internet connection. And I will say that as far as if you have a potentially unstable internet connection, I would arrange for you to either be going to campus to participate in class and maybe signing up to take your exams on campus if you have a iffy internet connection. Okay, because obviously this class is all through the internet. So we'll have weekly homework assignments, weekly classes, there's quizzes and exams. So you guys are expected to be here on Tuesdays at 1 o'clock Eastern time. There's no more, I'm going to go to your Monday section. I'm going to go to your Friday section. You're expected to be here. Okay. And I ask for any kind of communication if you're not going to be in class. And if it's like an emergency or a doctor's appointment, I'm going to ask you for documentation. Because even though I have to mark you absent, if you're not here, I can send along a doctor's note to Dean Brown and we can see what we can do. Okay. There's several places to find both my contact information and Dean Brown's contact information. Okay, it's here, and you all have a copy of this PowerPoint. I sent this, it was one of your announcements. So we're on slide 3. So there's my information, my email, and then Dean Brown's email and phone number. I should have put my phone number on there, but you can find my phone number in my instructor bio page. Okay. I don't care if you call me or text me. Just identify who you are and maybe what section you are. But I have no problem with calling and texting and all of that. All right. So keep both of this handy, both of these this information handy, especially Dean Brown's. Okay. If there's an issue in class, let's try and figure it out one-on-one. Okay, you and me. Okay. If we can't figure it out, then you have to go to the course lead, which is me. So we can't figure that out. So we'll go to Dean Brown. Okay. Does that make sense? And before I forget, time-wise, this class is 1 hour and 40 minutes. What I've done in the past, if it's okay with you guys, is we don't take a break and we finish up in 1 hour and a half. Is that agreeable to all you guys, or
Yep.
yes?
Yep.
Is there anybody that would be an issue for? Okay. Okay. Good deal. What am I going to do? I'm your first contact for any issues. I'm available by email, canvassing, messaging. That means my email, outside of Canvas. That means you can email me inside of Canvas and by phone. All right. I hope to provide you with lots of feedback during the course of how you're doing. Giving you specific feedback about certain assignments. I don't write a book, but I like to give feedback. I'm experienced in this content area of community nursing. Okay, I feel confident, very confident teaching this class. I've been teaching this now for 3 years. I sent you a announcement early on about etiquette. I don't have maybe 1 or 2 issues in my first couple of terms. I don't have any issues with etiquette in my classes, right? If I do, I'll pull you aside and we'll talk about it. But I expect positive communication, courteous communication, each of us being treating each other with respect. We only have 2 campuses in this class, so that's good. So a lot of you guys know each other. You guys know each other, so this is great. Yesterday's class, I think I had 7 campuses. So yeah, this is great having you guys in 2 campuses. Let's see, be considerate of others' experiences, feelings, perspective. I love to get real life scenarios and real life examples when we talk about certain topics from students. I like to be interactive. Okay, I don't want to listen to myself talk for 1 hour and a half. Okay, I don't. So I like for you guys to participate. Okay. Our class starts at 1 o'clock, ends at 2:30. Now that we're not going to do a break. Mandatory classes are mandatory. And if you don't attend a class, obviously you get marked absent. And we'll talk about the absenteeism. But remember, if you don't attend a class, please watch the recording. Okay. This is a lot of stuff. I'm trying to get my computer. Okay, there you go. Make sure you watch the recordings. And if you come late or you get distracted during class and you're off camera, which, by the way, I need everybody to be on camera. There's a couple of students who are not on camera right now, and I need you on camera. Okay, and I don't want to deal with the camera thing. You're expected to be on camera. I don't want to remind people to go on camera. It's 1 hour and a half a week. Okay. I'm going to kind of move through. Everybody knows the late policy, right? Okay. It's simple. You have to let me know. You need to let me know if you're going to be late. That's number 1. If you let me know, and this is the company policy. This isn't mine. If you let me know that you're going to be late, then you will have the ability to up to 7 days to turn that in, whatever assignment it is, for a 10% deduction. If you don't let me know, there's no 7 days. I don't know how to be any more clear in saying that. I run into this with a student or two every single term. You got to let me know first. All right. Then you have your 7 days. No communication with me, it's a 0. So, for example, I go in on Mondays and check for an assignment. If I haven't heard from you, I just put zeros in the grade book. There's no 7 days. Okay. And then after this, let's say you are extended that 7 days. That's all you have. You got there's no after 7 days, it's a 0. Okay. I had a student last term trying to turn in 4 NCLEX assignments in week 12. And they were due in weeks 3, 6, 9, and 11. Don't do that. Don't do that. Attendance, we all know the attendance drill, right? You come in at 101, you got 15 minutes docked against you, right? It's all in 15-minute increments and it adds up quickly. All right. So I think the next couple of slides are attendance, but attendance is pretty simple. Just come to class on time and stay for the 90 minutes. Get here before 1 o'clock, right? If you get in here at 101, unfortunately, I have to dock you 15 minutes. If you get in at 110, it's still 15 minutes. But then once you come in after, say, 115, let's say you come at 116 and you move to 30 minutes. Okay. So just don't be late. Don't be late. What was I gonna else was I gonna say about attendance? I got plenty to say about attendance. Oh, I know what I was gonna say is, Zoom records attendance along with the class. So I get a report right after class, and it tells you exactly when you signed in: 1 o'clock, 12:54, 1:05. So that has to match the report I sent to the registrar. So I know it seems silly, 101, 102, but it is what it is. You guys know, all your full names are in here, so that's good. Sign in with your full names. You got to be on camera the whole time. I don't want to look at walls. I don't want to look at ceilings. I want to look at your smiling, pretty faces. Okay. If I have to ask, I don't want to be I hate to get distracted. I can't walk and chew gum at the same time. So if I've started class and people are coming in, I don't get flustered, but it's just a distraction to me. So, if I ask you to turn your camera on and you don't, I'm just going to remove you from class. I can't deal with the distraction. And that's actually the policy. And then please don't come to class in your car. Okay. Whether you're driving, passenger, pulled over, in the parking lot somewhere, you cannot be in a car. Period. Okay. You guys all know about the 14-day rule, that if you don't come to class for 2 weeks in a row, or you haven't access to your shell in 14 days, you'll be dropped. Attendance is mandatory, taken daily. My report goes to the registrar. It has to coincide with the attendance report that comes off of Zoom. Everything is included: being late, early departures, not coming to class, 15-minute increments. I'm just reading through her. Students with chronic absenteeism in excess of 20% of the scheduled hours for a course may receive a failing or reduced grade. So here's how your attendance will work. If you end up at 5%, you get an email. Then at 10%, you're required to meet with me. 15%, we meet together with your dean. Okay. If you get to 20%, it becomes kind of a problem, because not only have you missed 20% of class, but then you fall into the category of potentially having a whole letter grade drop. And this isn't new information to anybody, correct? Yeah, you guys should know all this. I just need to go over it with you. You should already be doing your 7 key steps to success, reviewing what's due each week, completing your reading assignments, any interactive lessons, live sessions are mandatory. Obviously, use your rubrics. That's the way I grade. Complete all assignments, study and complete exams and quizzes. We'll talk about that when we get to the module. To be successful, keep in contact with me. Pardon me, have a reliable internet connection. I don't know how you keep organized. I have a calendar on my phone. I use my phone all the time. That's my calendar. Everybody has their own way of organizing. I'm trying to identify a quiet place from distraction to complete your work. It's hard when you have a lot of distractions. So hopefully you can find a quiet environment. And for some, that may be going to campus. So just be mindful of that. We already talked about reliable and unreliable internet. Go to campus. This is a tough term. Pardon me, as far as workload in your other classes. This is a term that's going to test your time management skills and your organizational skills. I send out announcements all the time, as you can see. I tend to over communicate. Most students like that. Some students, it makes them nuts. I would log in every couple of days. Usually you guys get notifications when an announcement is posted, right? Do you guys get notifications? Yeah. I send out a weekly announcement every weekend for the upcoming week. I've sent out a whole bunch of announcements. We'll go through those and I'll explain those to you. Just turn in your work on time, right? Get it done, turn in your work on time, and then move on to your next class. Don't procrastinate. You already know what to do day 1 of the term. If there's anybody that hasn't completed their technology quiz and syllabus review, then you're not able to access the content of the course. So I think there was one student when I looked last night that still hadn't completed those, which means she hasn't been able to access the course. So I think most everybody else has done that. Day 1, you guys were already here. You're already doing that. You got to come to class prepared. And we'll talk about the quizzes. The quizzes are given at the beginning of the class. All right, so come to class prepared to discuss concepts. And I provide you a couple of resources to prepare for class, and we'll talk about that when we get to the modules. Attend review sessions for exams. We'll talk about that. Meet with faculty to discuss difficult concepts during office hours. I always list my office hours as the hour before class. But let me know if you want to meet during that hour before class and I can jump on. But I'm very flexible about meeting with you any given day, morning, noon, or night. Okay? So it doesn't have to be during office hours. All right, schedule tutoring sessions with me. We'll talk about that when we get to the modules, but I can't stress enough that if you're struggling, you've got to reach out to me. Okay? Don't need to do that. This is in your syllabus, but here's our grading. You have 3 exams worth 55% between the 3 of them. Then you have 5 quizzes, which is the other 5%. So that gets you to 60. Quizzes are worth 1% each. And then you have your HESI. Okay, so that gets you to your 80, the top 3. All right. And you all know that those are KGAs, right? Those have to be proctored. And we do the quizzes in class. We'll talk about that when we get to the modules. You have 4 NCLEX questions, sets of questions, each worth 50 points for a total of 200. Those are 3, 6, 9, and 11, I believe, weeks. You have a community research project, which another name for that is a vulnerable populations project. That's worth 5% due in week 10. Completion of your HESI prep assignment, I'll show you that. That's in week 9. That's 5%. You had a couple of case studies, weeks 4 and 9, I believe. And then you're going to have, we only have 2 discussion questions in this class, and they're in weeks 1 and 2. So that's great. After week 2, there's no more discussion questions. All right. But remember, as you know, discussion questions, the initial post is due for you guys tomorrow night. Right. And then you have till Sunday to do your peer reviews, peer responses. Right. The third activity in this discussion question group project is you have one group project. And the good news is we only have 2 campuses, so I'm going to try and assign you guys with your teammates on campus. All right. And it's called an infectious disease project, where I assign your group an infectious disease, HIV, hepatitis, COVID, influenza, rubella, whatever. And you guys do a mini research project on that. Okay. And that's due in week 7. All right. And that's it. So that's the workload. I'll turn on homework assignment. I'll turn on homework grades probably, I don't know, week 6, just so you can see how your homework's factoring into your overall grade. If you're turning in your homework, it will go up. If you're not turning in your homework, it's going to go down, right? This is not a class you want to have a homework fail. Okay, there's just not that much to do. Okay, you guys already know the 78% rule, right? At the end of the term, you have to have 78% for your homework to kick in. Is anybody unclear on that? So between your 3 exams, 5 quizzes, and HESI, you have to have a 78%. And then you get credit for your 20% of homework. Quizzes. They are completed in class. They are completed at the beginning of class. All right. So quizzes are part of your KGA. Quizzes are designed to be given at the beginning of the class to allow me to have an understanding of what concepts you might be struggling on, and if you're coming prepared to class. Okay, there's only 1 attempt on the quiz. I give you the first 15 minutes of class to do your quizzes. There's 10 questions. Okay, and then we'll review the quiz. Okay, so you're expected to come prepared. All right, and for a lot of students, the 1% of quizzes they're important, obviously, but for some students, they're make or break at the end of the term passing. So I do want you to try and come to class prepared. There's 2 things you need to do. We'll talk about when we get to the modules, is to review your weekly notes that I'm sending you, your concept notes, and do your reading. After that, you're fine. Exams, there's no changes in exams. None. Okay, I don't open up exams until like an hour before the exam. And that's for exam integrity. Whoops. What did I just do here? So you'll get an email from me an hour before the exam that it's ready to download. Okay, that's the policy. Okay, there's no change in the way you take exams. We do it online. You have 1 attempt. You can't stop, pause, resume. It's the same way it's been. Okay, I would suggest between now and week 4, before you take your first exam, that you go into ExamSoft and make sure your account is current. I would suggest you do that so that we don't run into technical issues during the first exam. Okay, one of the things I forgot to mention is if you have accommodations, they don't just roll over. Okay, let me know if you have accommodations. Okay, we have to get that reapproved every term by Dean Brown. So I have no idea if any of you have accommodations, but if you do, get in touch with me. And while I'm on that subject, if you are repeating the class, or you are a re-entry student, or if you are on a SAP warning, let me know ahead of time. Send me an email. All right, I have some things I do with those particular students, but I will know that information once I get my roster, but I won't get my roster till probably early next week. And I want to start my reach out process early. So if you're repeating re-entry or SAP warning, just send me an email. You don't have to put anything in the chat today. Just send me an email. Okay, with regards to exams, you're expected to take the exam on Tuesdays at 1 o'clock with your class. If you guys would like to take your exams on campus, I'm fine with that. Okay, I just need some notice and proctor information. And in the past, I have had Essington students on campus a lot taking their exams. So, but I need to hear from everybody who wants to take it. You know, if somebody says, oh, there's 5 of us that are going to take it on campus, I need to hear from all 5 of those students. Okay, so I have no problem with you taking exams on campus. It's 72-hour notice right here, 72-hour notice. And I need your proctor's information so I can confirm that with the proctor and the dean. Okay. If for some reason, this is, you guys know all this, exams are to be proctored. Okay, so missed exams. If there's an emergency, obviously we'll sort it out, no problem. But if you just are no show for the exam with no communication, it's a 0. And that's the policy. If you have missed the exam for personal reasons, and you have let me know, you'll have up to a week to make that up, and you have to take your 10% deduction, right? But exams missed to emergencies, I'm going to ask for documentation so we can get that to Dean Brown, and she's the one who will approve for you to retake it within a week. All right? You got to contact me before the exam. I can't do anything after you've taken the exam. So if something's going on and it's preventing you from being successful or has impeded your ability to prepare for the exam, you got to let me know before. Once you've taken the exam, there's nothing I can do. Right? Communication. Always contact me if you have any problems or you need additional help. Homework. You should already be doing this: planning, prioritizing, completing, and submitting. Right? Like I said earlier, I don't know how you organize. There, you can take your assignments, put them into a calendar. However, everybody's got their own organizational system. Whatever works for you, keep working. Keep using that. Late work policy, we already went through this. Got to let me know. NCLEX, you guys, in all of the NCLEX weeks, 3, 6, 9, and 11, you have the categories to select. They're already laid out for you. Okay, I'll show you that in the modules. So you know how everybody knows about NCLEX. All right, here's my beef with.
Sorry, you got to do.
Nope.
Is it 50? Oh, it is 50 questions.
Yeah, it's 50 questions 4 different times. Okay, I need you to submit the batch of 50. I can't accept 2 25s and I can't accept 5 10s. Okay, it doesn't, once you break down the 50 and do 2 25s, it doesn't give you an accurate representation of the categories you selected. And the same rules apply. I cannot, as prior classes, I cannot accept a screenshot. I need the full PDF. Please do all your assignments from the module. Access all your assignments from the module, especially the NCLEX. Okay. My beef with NCLEX is when you guys turn in an NCLEX that's in the 20s and 30s. Okay. I'm going to send it right back to you and reopen it for you and ask you to redo it. You don't have to. But here's the deal with NCLEX. There's a reason why we're giving you 200 NCLEX questions. these are to help you prepare for your NCLEX exam. Once you can do the NCLEX questions as many times as you want. You can only submit it once. So if you do a set of NCLEX questions and get a 20 or 25, go back and read the rationales of why you got things wrong. Learn from it, then retake it. And maybe now you're up to a 40. Go back and read those rationales. And then I really want students submitting between 45 and 50. I mean, they're each worth 1.25%. So, but that it's not so much that, it's you learning from the exercise. So I don't have any idea how many times you've taken it before you submit it. It may be once, it may be 5 times. But what I'm saying is take advantage of these NCLEX assignments. Take advantage of a low score, read remediation, just like you do with your HESIs. That's how you learn. So don't be submitting me a 20 and a 30. I mean, you can, but if there's time, if it's not on that Sunday, if it's prior to Sunday when it's due, I'm just going to send a message back and say, hey, I've reopened the HESI if you NCLEX assignment if you want to retake it. And you don't have to. If it's on the Sunday, I can't mess with having you redo it and get it back to me. So just be mindful of that. Okay. So that's my beef with NCLEX questions. If you turn in a 20 or 30, my assumption is you didn't get much out of it. Okay. And here's the screenshots are not acceptable. I need 50 questions submitted at the same time. HESI, you've got 2 case studies. We are not doing CJ Sim yet in this class. We're not. That's going to come, I think, next term. So we have 2 HESI case studies that are already preloaded in your modules, and you just access them through the module. Okay. I think they're weeks 4 and 9. You don't need to submit me anything. They're automatically posted in the gradebook. Okay. Let's see.
Wait, was that the HESI case study? Sorry,
Yeah, you have 2 HESI case studies, weeks 4 and 9. Yep. Writing papers, discussion posts. Try and use APA format. I sent you a cheat sheet for APA format in one of your announcements. You got to look at your rubrics. That's how I grade. All right. Please use your rubrics. You guys are very familiar with that. There's your APA, taking quizzes and exams. I have all the quizzes unpublished right now. We only publish the quizzes on the day of class. And that way people don't do them ahead of time.
I'm sorry, Professor, interrupt. Did you say we have a paper?
You're gonna have a vulnerable populations PowerPoint. Yep. We'll go through that in a minute when we get to the modules.
Okay.
You guys have a 1 group paper to do and 1 PowerPoint assignment. Technical issues, you guys know what to do. Stop and let me know what's going on during quizzes and exams. We'll have to get it sorted out. HESI, we're not really going to talk about right now. Other than you have 1 attempt in this class for your HESI. You'll be assigned a date and a time that your campus will be taking it, and I'll let you know that towards the end of the term. HESI is worth 20%. You guys have remediation, depending on what your score is, and we'll go through this towards the end of the term. We know about exam security for HESIs. Are you prepared to sit for the HESI? What remediation could your online instructor review? These are just review questions that you need to think about towards the end of the term. Okay, so that's your orientation PowerPoint. Everybody has a copy of it. It's in your announcements. All right, Joy, I need your camera on. I can only see a couple of people when I share my screen, so
My camera, Excuse me, my camera is on. You
Oh, I
can't
can't,
see,
no, I can't see you.
yeah, my camera is on. I can see everyone and you.
Oh,
Miss
She
Joy,
on
it
two
looks like,
different
I mean,
screens.
Joy, it
well,
looks
we
like you're
can't
all in
see
two
you.
times.
What
We
you
can
say,
see her.
Phil?
She on two different screens.
What happened?
We can
Oh,
see you
Joy,
on two
yeah, you're
different
on two different
screens.
screens. There you are. Oh, I see you. You're above.
Well, I don't
I
know
see
why
you. I
that
see you
is.
now. I see you now.
How do I
Okay.
take it off the second
No,
screen?
you can kick off the, no, don't worry about it. I see you. Okay, next is, let's go, first, anybody have any questions about the orientation PowerPoint? You all have a copy of it if you need to refer back to it. Okay, so next, let's go through the syllabus. Let me share my screen here. Okay. Can you guys see that? I'll make it a little bit bigger. I can't. All right, you guys can, so what is this course? Okay, we're gonna, you guys are gonna have an introduction to promoting health and wellness with individuals in diverse community-based settings. All right, some of the key concepts are gonna be covered. There's a lot, and we'll go through them in a minute, but wellness promotion, independence, interdependence, discharge planning, chronic illness, HIV, healthcare delivery environments. Maybe we're in an outpatient clinic, a home, a facility. Okay, we kind of reviewed that at the beginning. You guys can review your student learning outcomes and the course objectives. Here's your, I need to know ahead of time if anybody's having problems accessing your books. Okay, we have 3 books. You should have access to all those books already. Fundamentals, Med-Surg, and Intro to Maternity and Peds. If you don't have access to those, you need to check with your campus. I don't know if I have any re-entry students. Sometimes it's an issue for the re-entry students because they have the older version and I have to provide them the conversion guides.
What books are we using for this class?
It's right here on your syllabus,
Okay.
right here. Required learning resources. Fundamental concepts, Med-Surg nursing, Intro to Maternity and Peds, with all the correct editions. You should, and these are books that you should already have access to from previous classes. Okay, so I need to know if anybody has an issue with accessing the books. Okay, if you're re-entry, let me know. And then here's the grading. We already went through this. Your unit exams, your HESI and your quizzes, and then everything else.
The maternity and peace was the 8th edition, correct?
Let's check. 9th.
9th edition. Okay.
Says here 9th.
Okay.
Yeah, make sure you have the right editions, because if you don't, I need to send you a conversion guide, but you should have the correct editions. Okay. HESI exam, we don't really need to talk about right now, but the expected level, the benchmark is 900. I always expect 1200. So we went through the late work policies and procedures. Okay, and here's your breakout of time. This is your 2-credit class. Okay, this is the estimated time over the whole course. Each credit is 20 hours. So this is it's estimated that your readings will take over the course of the whole term 16 hours. Your NCLEX will take 8 hours. So that is 2 hours per assignment. Your vulnerable populations project should take 4 hours. Preparation for KGA assignments exams, quizzes, 10 hours, and then your HESI prep, 2 hours. Okay. And I just want to run through our weeks because I want to give you an idea of all the fun stuff we're going to be covering for community. Okay, this is broken out into 3. This is our weeks, our weekly map. Okay, on the left side is the concepts we're going to be covering. All right, so this week, we're not covering content in class. I sent you a recording, but this week we're covering Introduction to Community Nursing, Levels of Healthcare Prevention, Healthy People 2030, Introduction to Vulnerability. Okay, the middle section is all your readings. Okay, in this class, you're going to have three different kinds of readings. You're going to have the book reading. Okay, you're going to have book reading. You're going to have Canvas course reading, which I'll show you where that is. It's right in the weekly module. Then you're going to have your weekly notes that I provide you. Okay, which is kind of a summary of all the concepts. And then this column to the right is your what's due. All right, so pretty simple to navigate this. So for this week, we got our 4 concepts. You have your readings, you have your Canvas course readings. So wherever it says Canvas course, you're going to find those in your module. And then you have what's due. Questions about that? So next week, you'll be learning about school nursing, growth and development, common childhood ailments, and that's what your discussion 2 question is about. Pick 3 of the common childhood ailments and follow the rubric. And same with discussion 1 this week, with our introduction to vulnerability. It's pick a vulnerable population in your community and answer some questions from the rubric. Okay, so next week we'll school nurse, growth and development, common childhood ailments.
And that's what the quiz will be on.
Mhm.
Chapter.
Family nursing, family health risks. Then in week 3, we start to get into, this course is very heavily focused on vulnerable populations.
Do you do any reviews or anything?
For exams,
Yes.
Yeah,
Exams, quizzes, whatever.
I don't do reviews for quizzes
But-
because your review for quizzes is your preparation for class. We do exam reviews, and I'll talk about that. So starting in week 3, we really start to get into the vulnerable populations. We talk about migrants, migrant farm workers, rural populations, homelessness, poverty. And then the next week we are talking about more specific vulnerable populations like pregnant adolescents, LGBTQ, mental illness, alcohol, tobacco, and other drug issues. Week 5, we talk about hospice and palliative care, death and dying, ethics, faith and spirituality in community nursing. And then week 6, we talk about some different kinds of community nursing, occupational health nursing, environmental health nursing. What are some barriers to learning? Talk about health education in the community. Weeks 7 and 8, we talk about infectious disease prevention and control, specifically HIV, TB, STDs. We'll do a little section on bioterrorism and disaster. Pardon me. And then in week 8, we do home care, community resources, case management. And then we talk about the care of complex chronic illnesses, which are very prevalent in the community setting. And then we finish up week 9. It's the last week of content. We talk about human abuse and violence, and then cultural influences in nursing. So we cover a lot. All this is part of community nursing. So it's an overview. So that's your syllabus. And then I want to
So
get
like
into
where it says quizzes, like are you doing the would the quizzes be on the chapters that it's under that week?
Yeah.
Or
Yeah. So if you look, I'll go to my assignments. This is what I see in my page. So you'll have to go through your modules, but here are your assignments. So your quizzes,
Mhm.
week 2, week 3, week 5, week 6. So so next week's quiz is going to be on next week's material. Quiz 3 is going to be on week 3 material.
Wait, so next week's the first quiz is taken in week 2 is gonna be on next week's material, not this week?
No, it's good. Well, a combination of weeks 1 and 2.
Oh, okay.
Okay.
And we checking that at the beginning of
You
the
take that at the
class.
beginning of the class. So next Tuesday, you'll be taking a quiz that covers material from week 1 and week 2.
Is there some type of concept to let us know what to pinpoint out of all the material that we have to know for those weeks?
Well, you have your concept notes and you have your readings. So your quiz could come from any of that material. Right?
Where do you get concept notes from? You make them yourself?
Nope. There, I sent you in. Let's go through the announcements. Those are in your announcements.
Mhm.
Right?
Excuse me, for like week 1 in the
Mhm.
mid-surge, it says community care is on page 123.
Mhm.
That's not, when I go to 123 in the mid-surge book, it's not matching up as community care. It's a whole nother, like chapter.
Okay. I'll take a look at that.
Okay.
Thank you for pointing that out. I'll have a look at that. Does it say it's in your med surge book?
When I opened it, it was just like a one little paragraph that said community care. Is that
Yeah.
what?
That's
Oh,
it. That's it.
so it's not necessarily the whole chapter.
No, just one page. As you'll see, let's go back to the syllabus. As you'll see on your reading assignments, you have very little full chapters you're responsible for. Okay? A lot of this is broken out since we're using 3 different books. Okay, so right here, community care, page 123. There's one paragraph about community care, correct?
Yes, just one paragraph that I saw.
That's it. It says all you need to know is page 123.
Okay, I was just trying to make sure. That's all. That's why I was
Yep.
asking.
And then up here, fundamentals, you're responsible for chapter 1.
Okay, so since you have that up, okay, so quiz number 1 is gonna be on weeks 1 and 2. So that means chapter 1 through 3, 5, and 6. Or what is it? CO, what is
This is your course outcomes. Don't pay
Oh,
attention
okay.
to this.
So
Okay,
it will
it's
be on the reading of
correct. Yes. So like look at next week's reading.
mhm.
Okay, they're all certain pages from your maternity book. It's not the whole chapters. You only have specific pages, right?
Mhm.
Not the whole chapter. Now, next week you do have in your fundamentals, chapter 11 and chapter 12, full chapter. Med-surg nursing, only 1 page. All right. And then when you see the Canvas course, it's in your module. I'll show you that. Okay, so you may have some full chapters and you may have just some pages. Okay. So in your have you guys gone through the modules yet?
Yeah.
Let's go through the announcements, okay? This is your etiquette announcement, okay? Here's your welcome message from Dean Brown. If you haven't read your announcements, I need you to read your announcements because a lot of the questions you're asking are right in your announcements. Okay, here's your welcome message from Dean Brown. Okay, here's a welcome to class message for me that provides you an overview of the class, what things we're going to be focusing on. It's kind of an intro to class. Okay, so I need you to read that. Then I've given you several, I've given you your APA. Here's your orientation PowerPoint that we just covered. I've given you some APA resources. I've also given you some math resources. If you struggle with math, there's 5 math questions on all 3 exams. Really basic math questions, conversion, setting up a formula for an IV drip. Okay, if you struggle with math, the first, I've sent you 3, but the one I would focus on first would be this one with Professor Bogart. Some of you might have her for peds. Okay, she has a YouTube channel and she has a really easy math tutorial, okay, about basic math. Okay, so if you struggle with math, have a look at her tutorial. Okay. Syllabus, I sent you that, math resources. There's some more math resources. Dean Brown did a tutoring session on math, a couple of terms ago. I've given that to you. Here's another message from Dean Brown that says when you can change your schedule, and it's this Friday. Right? So if you haven't read your announcements, read them. Now you'll get this weekly announcement. I know it's front loaded because it's the beginning of the term. You're going to get this message from me every week. It's going to say week 1 content information attachments, week 2 content information attachments. Most of this announcement is copy and pasted from your syllabus. Okay. All right. So I give you a general overview of what we're going to cover. Okay. I copy and paste homework to-do list. All right, so this is a summary of the readings for week 1 that I took right from your syllabus. And then I give you your week 1 blueprint concepts, and then week 2 blueprint concepts. It follows right along the syllabus. So if you haven't opened it yet, let's open it. Okay, so you're going to get this every week. This follows right along with your concepts on the left-hand side of your syllabus. What am I doing here? I won't. There you are. So you're going to get this every week. Okay, there you go. All right, so this you'll get every week. Here's your concepts. I've copied this from the left side of your syllabus. Here's your 4 concepts that we're covering. I've copied and pasted your readings onto here from your syllabus. And then your notes are simply addressing each of those 4 concepts. So your first section is Introduction to Community. Second section is Levels of Prevention. Third is Healthy People 20. So your notes follow along with the concepts. And this is a good summary of what's going to be covered in the class that week. Does that make sense? So everything is connected. Your weekly notes are a summary of the concepts covered. I'm trying to make this not real complicated. Does that make sense?
Yeah,
So-
so they're sent, you say you send them every Sunday,
I send them every week.
every week? Okay.
It'll be week 2, week 3. So week 2 will cover the concepts in week 2. So it's really organized and really targeted.
Right,
Okay?
I'm just asking if it was prior to the quiz, if we get that sent to us.
Yeah, you get notes sent to you every weekend.
Okay, thank you.
Yep. So my suggestion to prepare for the quizzes is do your readings and read your notes. Read your weekly concept notes. If you've done that, then you'll be fine on the quiz. Okay, so let's clarify. So quiz 1 is in week 2. So you'll be responsible for week 1 and 2 material. Quiz 2 is in week 3. So you'll be responsible for week 3 material. Quiz 3 is given in week 5, since you have an exam in week 4, right? So your quiz 5, it will be content from weeks 4 and 5. Quiz 4 is given in week 6. And you'll be responsible for week 6 content. And then quiz 5 is given in week 8, since you have an exam in week 7. So quiz 5, you'll be responsible for information from week 6 and week 7. No. 7 and 8. Right? Does that make sense? I'm getting way too detailed. I've not done this with my other classes, but you guys are asking a lot of quiz questions. So does that make sense? You're responsible for the material for that week. And if it's been a quiz week, then you have 2 weeks that you're responsible for. So okay. Now in your modules, if it says Canvas reading, okay, your Canvas reading is right in here in your, so let's say week 1. You should be clicking through all of this. All right, so you have your course objectives. Here's your weekly concepts. We're in week 1 now. So there's you've seen this 3 times now. You've seen it on your weekly notes. You've seen it on the syllabus. Everything connects with each other. So there's your 4 concepts. And here's your weekly reading. So I just copy and paste this right onto your weekly notes. Okay. When it says see Canvas course, it's right in here. You got to keep going. And here's your 4 Canvas course readings. They're right in your module. So you have your introduction to community health, your levels of healthcare prevention, your Healthy People 2030, and your introduction to vulnerability. So when it says Canvas reading, that's where it comes from. Does anybody have any questions? In some weeks, you have Canvas readings. In some weeks, you don't. Most you do. Okay? And then there's your discussion question due tomorrow night. Okay? Does anybody have any questions about this? About where to find your Canvas readings? So you're going to have, you may have book reading. You may have Canvas course readings, which are built right into each module, weekly module, if there are any. And then you have your weekly notes. That's how we're getting through class. There's a couple of assignments I want to mention. This class gets really heavy around week 9. Okay, so any work that you can be doing before week 9 will benefit you greatly. So the big assignments we have are, and you have to go to the week they're due. So week 7, this is when your group project is due. Okay. There's a couple of things in here that I need to correct, but I have to do it anyway. In week 7, I'm not going to make your assignment due until Sunday, because it's not an assignment in which you have to respond to peers. So that's incorrect. I couldn't get this changed in time. So we'll review this when I send out the groups. But the difference in your group project is it's not going to be due till Sunday, and there's no peer responses. And everybody has to submit a copy of the final project. But we'll talk more about that as we get on with the term. All right, but I'll assign groups in the next couple of weeks in case you guys want to get going with it. Okay, so that is in week 7. Then in week 9, Okay. HESI prep assignment. This is something that I would put on your desktop this week. Okay, because you're going to be working on, it's worth 5% at the end of the term. You're going to be working on this all term. Why can't I get this? Okay, I'll bring it up. Are you guys, has anybody been able to access this document yet? I was able to access it with my class yesterday. Here we go. This is something that you want to pull out early. Get this on your desktop. This is called a HESI prep. This is you're gonna build your own study guide for your HESI. It's not due till week 9. However, this needs to be a work in progress. This is not an assignment you want to pull out on Sunday of week 8. It will take you forever to do. Okay? These are topics that are covered on your HESI. Okay? And I know that because I can see the topics from remediation of what they're asking. I don't know the questions they ask on HESI, but I know the topics. Therefore, we've put together this assignment for you. I've just recently updated it as to what's going to be covered on the HESI. So as we go through these sections in class, what I'd like to do is spend the last 10 or 15 minutes of class with everybody pulling this up together, and we'll fill out the boxes that we can, that we've covered. Does that make sense? And the one thing we're going to add that's not on here, I got feedback from my classes last week when we did our post HESI. All the groups, I had 4 sections last term. They all told me there was a lot of primary, secondary, and tertiary questions. So what we're going to do is we're going to try and add primary and secondary and tertiary interventions for each of these boxes. So my point is, this is not due till week 9. However, I would hope you would want to save it to your desktop early so that we can work on this all term. So that by the time we get to week 9, you can just submit it. Does that make sense?
Yes.
Okay. All right. So that's week 9. And then the last big project you have to do is, it's called a vulnerable populations PowerPoint. That's due in week 10. Okay. So it's an extended version of what you're being asked to do in your first discussion question this week. You're going to be selecting a vulnerable population from your zip code, not national, the stats on national homeless or national teen pregnancy. It's from your zip code. This is where a lot of students lose points on this when they submit it, because they've just given national statistics. But if you look at the overview, if you look at the rubric, okay, it's very specific to a population in your zip code. This is a PowerPoint assignment. Okay, this goes through your community research project, what you need to do, population description, health risks, resources. I point this out to you early because it's due in week 10, but you can start working on it earlier than week 10. Right? And so when I say towards the end of the term, it gets heavy, because it does. Week 9, you've got a HESI prep assignment. You've got, I think you've got NCLEX. Week 10, you've got a lot of things. Week 9, 10, and 11, you have a lot of things. All right, so the sooner you can get working on some of these projects, the better. Okay, our exams are in weeks 4, 7, and 10, and then you jump right into HESI in week 11. I will be sending out a master schedule in the next couple of days. I'm just waiting to hear from one more instructor for review dates. Okay, for exams, you will receive a blueprint concept study guide. Okay, that is a shortened version of your notes, your weekly notes, your readings, and lecture. But it's your study guide for your exam. All right. You probably won't get that till next week because there's some stuff I have to change on it. Okay, so you have a study guide for each exam. The other thing is the week before each exam, so in weeks 3, 6, and 9, we'll have 3 live review sessions by each instructor. We'll each do one. Okay, so they have the opportunity to go to a live review. Those will all be recorded and you'll be provided all of those recordings as well. Okay, and then in week 10, before your HESI, I know it's an exam week for you, but in week 10, we'll also be providing 3 live HESI reviews. Okay, so I'll be sending out that schedule in the next couple of days. There's 2 other instructors, Professor Kershaw, Professor Ford, that teach with me. They teach on Fridays. And they'll be doing the exam reviews as well, and the HESI review. So there'll be plenty of opportunity for you to attend review sessions, and you'll also have the recordings. Okay. Let me make sure I covered. I told you about repeat, reentry, SAP, and accommodations. Access to books, you got to let me know if there's a problem. HESI prep assignment. You're going to get weekly concept notes, quizzes I'm not publishing to the day of class, exam reviews, study guide, campuses I got, side groups. I told you I'll do that in a couple of weeks. So I've covered most of what I wanted to cover, or all of what I've wanted to cover. We've been through the orientation PowerPoint. We've been through the syllabus. We've been through the modules. I pointed out some bigger assignments. So really what you have is 4 NCLEX assignments, a couple of case studies for homework, your vulnerable populations in your HESI prep. It's manageable. What are you guys thinking? Questions? Nobody has any
Get
questions.
that organization schedule going.
What? What are your
Same.
questions?
No question.
Pardon me?
I said a question, but you said, what are we gonna do? I said, get up, organized and get a plan
Yeah.
going.
Exactly. Exactly. I mean, after next week, you don't have any more discussion questions. Right? I mean, there's a couple of weeks, if you look at assignments due, it's just the quiz. Right? As far as working ahead, I've got everything open except the quizzes. Just be mindful that you're not shortchanged. Just be mindful you're caught up with your other classes. There's no need, usually on the weeks that the NCLEXs are assigned, it coincides with the material we cover in class. So, I encourage you to wait. If you want to go, I mean, definitely start working on your HESI prep and you could start working on your vulnerable populations assignment. You can turn those in whenever. But don't wait. I'm telling you guys, do not wait till week 9. It's going to get too overwhelming. Then we're talking about exam 3. We're talking about HESIs. You got 2 other classes. So get going on some of these things. It's going to be fine. We're going to all be fine. I promise you.
So what about
Just
the
carve
lecture?
out a little bit of time to get your community work done. And then you're done for the week.
What about the lecture for today?
I've sent a recording.
Okay.
So-
okay, okay.
Did you guys not see that? It's in the announcement, the week 1 announcement. Yeah, you guys got to stay on top of these announcements. Okay, you should have been this week 1 content information attachments should have been way reviewed by right here. And I said that up in the assignment.
When did you
said your-
send them?
Week 1 blueprint concept notes are attached to this announcement. Will help guide and summarize the content material that will be covered. Week 1 concept recording is also attached. It covers the topics to be covered this week. So that's already in there.
Okay, so you just do things a little differently. I think that's what it is, and we'll adjust to it.
Well, the only recording you're going to get is for week 1 because we have to cover orientation. This is an orientation
Mm.
week. Everything
Okay.
else is live.
Oh, okay.
Yeah, so next week I'll review week 1 as well, and we'll do week 1 and 2 together. Right? And then week 3, we'll do week 3. And then when we have an exam week in week 4, the following week, week 5, we'll cover 4 and 5. So everything's live.
Okay.
But I wanted to give you a heads up with a week 1 recording.
Mm-hmm.
Everything else is live. Does that help? Okay. How are you feeling about things an hour and a half later? You ready to roll with this course and get through it? And what's your feedback?
Sounds gonna be an interesting 12
Yeah.
weeks.
Just planning and prioritizing, that's all.
Yeah. Well, I think about it. It doesn't matter where I told this to my group last term. Even if you don't work in the community nursing, let's say you work in the hospital, you are still going to be working with community healthcare workers, right? As you're preparing for discharge, as you're, preparing to, work with getting other services that the client may need when they go home. You're always going to have interaction with the community healthcare teams, right? Any of you work in the community now? Long-term care facilities, prisons, medical
I work
office
in the well, I
buildings?
work at the hospital, so I work at.
Okay.
Mhm.
Anybody work out in the community now, medical office buildings?
But I have done private care.
Yeah,
So.
yeah. Yep.
Mhm.
Well, as I promised, it's 2:30, so it was really nice to meet everybody. If you want to stay on and ask me any questions or reach out after class by email, please do so. It was nice to meet everybody. I'm looking forward to a successful term with everybody. Okay,
Same. Thank you so much.
it's gonna be
Thank
fine.
you.
It's gonna be fine. Don't worry, it's gonna be fine. Okay,
Thank you.
bye.
We hope so.
Yeah, it's gonna be fine.